Dr. Rob, it's been wonderful to have you here talking all things EXOIE with us. Can you share with us what EXOIE is and how you've brought it into the UK?
So EXOIE is a revitalizing complex in itself, and it's not one single thing. It's actually a series of treatments together is what makes up the complex. You know, nothing we do in medicine and aesthetics is a one-hit wonder. You know,
Yes.
we don't do a laser treatment once, we don't do RF microneedling once, you know, we don't do neurotoxin once, we don't do skin boosters once. So we have to continually stimulate the system, and that's literally what the basis of EXOIE is built around. Ideally, you have a pre-treatment portion, a day of portion, and then a recovery portion as well. So first and foremost, we pre-treat with the detox.
Yes.
And ideally, what you're going to do is for twice daily for 7 days is going to pre-treat, and that's going to stimulate autophagy in the skin and also help with a lot of hydration as well, because we know clean, hydrated skin is going to receive a treatment much better than dried out, you know, non-clean skin, right? So the energy is going to be received in, because most of the time our target on most of our energy-based devices is water.
Correct.
Correct. And so if we have very hydrated skin, you're going to receive more energy, then you're going to have a better response from the skin as well. So then, day of procedure, we move to the EXOIE. So ideally, what you're going to do is you're going to pre-treat with this prior to numbing, and what you're doing is then pre-treating the skin for anti-inflammation, with anti-inflammation factors.
Correct.
And it's a booster because you're getting a treatment within a treatment. You're going to massively stimulate hyaluronic acid production, collagen production, and elastin production. And so obviously that's what we're trying to do when we create controlled wounds, where we're injuring the skin, right? It does create some inflammation. So the goal of EXOIE is to shorten that inflammatory period from 6 days down to a few days, right? So we get to the proliferative phase much faster. So we change that wound healing curve, and then you're getting that treatment within a treatment by hyper-stimulating collagen, elastin, and hyaluronic acid production by not adding any synthetics in, but allowing the body to do what it naturally does and giving it thousands of growth factors so all the building blocks are in place. And then lastly, repair. So repair's idea is that you're going to continue the signaling of EXOIE. So you're going to continue that anti-inflammation and continue that stimulation of collagen, elastin, hyaluronic acid production. And so you continue down that wound healing path much faster with reduced inflammation and stimulated building blocks of the skin as well.
What I really want to do now is just elaborate on this 15-day system, because this is essentially what I brought into my practice, because I carry out a lot of microneedling radiofrequency, I carry out a lot of fractionated laser treatments, I carry a lot of injectable treatments as well. But essentially what we're trying to do is to reduce the pain, the inflammation, the downtime, bruising, swelling, erythema, all of those things that come with our in-clinic treatment. So I brought this in as an in-clinic procedure.
Absolutely.
Correct? Yep. And what we're trying to do is, as you say, prepare the skin. So with pre-treating the skin for 7 days with detox, we are creating this new system called Autophagy. Now, it's nothing new, because autophagy has been known for years. But I think I would just love you to explain what autophagy means to the UK public and beyond, because I just found that step really interesting.
Absolutely. So autophagy is going to be essentially stimulating the immune system within the skin, so the macrophages that come and eat toxins up in your skin and then we'll push them out. So it wouldn't be uncommon to actually see a purge from the skin after a couple of days, which is a good thing. That is expected, and that way you know the skin is doing its job. So it'll come and stimulate those cells, and then they will eat up whatever toxins, exposure, makeup, some things, whatever we're putting on our skin, different moisturizers, they all carry something within them that really isn't supposed to be in our skin. So your skin's going to push that out, right? And then you'll see the purge a lot of times, and you're also going to be hydrating as well, extensively hydrating the skin.
Super important.
Very important.
Yes.
And so that way we have really well hydrated and clean skin from the inside out is really the goal of what detox is doing.